We're now going to hear from Pfizer's Dr. Robert Popovian, who will discuss ways in which healthcare costs and outcomes can be improved through biosimilars. Welcome, Dr. Popovian.
Good morning. I hope everybody's doing well and staying safe. It's sort of like daunting to come right after a panel such as the one we just had. And I have to say, it is a very important issue what they were discussing, but it's equally important to talk about potentially how to maintain our healthcare system as currently exists to mechanisms that can provide cost beneficial alternatives in the marketplace. And my message today is really to the employers. The employers are a group that really have taken to the forefront of providing healthcare in the United States, and they need to understand and better leverage some of this new technology that is out there in the market to be able to help reduce costs and improve benefit design and actually improve care for the majority of their folks. So let's get started. So why am I here talking about biosimilars? Because biologics, which are very important treatments, and they are used commonly for treatment of cancers, arthritis, inflammatory diseases, diabetes, have never had really any market competition in form of a generic medicine. This is very uncommon, and you know, as many of you go to a pharmacy and you get these small pills, there are generic alternatives that are much less expensive. Well, for the last decade in the US, pharmaceutical companies, Pfizer, Merck, you know, other companies out there have been developing a class of drugs called biosimilars, which are primarily a generic version of the biologics. And biosimilars have been developed for the sole purpose of bringing competition into a marketplace that really doesn't exist. And just to give you a perspective of what the market for biologics is, biologics actually, as a prescription, volume of prescription in the United States is a very small number, but they consume about $125 billion annually of our pharmaceutical budget. To just put it in perspective, we spend in the US between the drugs that we go to the pharmacy and get them in the pharmacy, and also drugs that are administered in a physician's office, we spend around $450 to $500 billion. And biologics by themselves, although they constitute about 1 or 2% of the prescriptions, they consume about 125 billion of that dollar amount. So they're very low levels of use. They're very expensive. And the reason primarily is because they've never had competition. Well, we do now in the United States have a competition, and these savings can be significant. And we're not talking about millions of dollars, we're talking billions of dollars that can be saved if alternatives of biosimilars are used instead of the originator biologics. And we've already seen these savings occur in the marketplace, but we need to accelerate it more because primarily is that the new technology and innovation is coming. There needs to be better ways of paying for that stuff. So regarding employers, I mean, just to put it in perspective, you know, there was a study done by ERIC, which is the ERISA Industry Committee. And in that study, the investigators looked at 13 self-funded employers, and they found that they could have saved in 2018 $400 million, just the 13 of them, if they would have adopted biosimilars in their benefit design. So that's the key here for employers to keep in mind, is that the adoption of the biosimilars need to happen and start in the benefit design that is put together by the employer with working with the insurer and the pharmacy benefit manager and so on. And the reason this is important for employers to take a lead is because there are so many perverse or incentives in the market to keep biosimilars and lower cost alternatives out of the market. The current system that the way it's set up for pharmaceuticals benefits or basically wants to have higher priced medicines with higher rebates. Well, biosimilars, as being cheaper versions of the generics and biologics, are cheaper medicines, and they don't provide that incentive. In just one study that was published in JAMA, of the 17 large health plans in the United States, 14% of those health plans designated a biosimilar as preferred. 33% designated them as non-preferred. And this is, keep in mind that these are lower cost alternatives that are not being adopted. So the whole thing, and my message to the employer marketplace, which you are, is that if we're going to be able to pay for the future innovation that's coming, if we're going to be able to improve access to everyone for pharmaceuticals, we need to have market competition for medicines that have been around for a long time. And if there are lower cost alternatives similar to small molecules that are the generics, we need to start utilizing them and adopting them in our benefit design. And it all starts from the employers. If you are able to better understand your benefits, especially on the pharmaceutical end, but not only the outpatient pharmaceuticals, because remember, biologics, a lot of them are not self-administered. They're given in a physician's office and they're through the medical benefit. If you do a better job of understanding your medical benefit and ask the questions of why have not they been preferred over higher cost medicines, you will do a service for your employers by expanding and lowering your healthcare costs. And, you know, again, we're not talking small numbers here. We're talking billions of dollars in savings. In that one ERIC study, 400 million in 13 employers if they would have adopted biosimilars. So there's evidence there that the employers can do more and they can save money. And biosimilars provide a very proactive private sector market competition that will alleviate or reduce healthcare expenditures in the pharmaceutical space without sacrificing quality at all. And in addition, it will provide an opportunity to pay for the future innovation that's coming in this marketplace. Thank you.